Was that okay? My name is Jessica Glick, and I'm a family medicine physician at First Primary Care.
What attracted you to First Primary Care?
The model of First Primary Care is what first attracted me. It is a direct primary care model, meaning that we work outside of insurance to help patients get as healthy as possible. And in doing so, we get to spend more time with our patients and get to know them better, which was very attractive to me. I could make my own schedule and really work with my patients without having a lot of other administrative burdens get in the way of that.
What makes FPC different?
So from a provider's point of view, the direct primary care model here at First Primary Care is a lot more supportive of physicians, I feel, because we are able to directly interact with patients. We are able to make our own schedules. We are able to have appointments as long as we want, which allows us to get to the root of the problems of the patients. And so we're able to quote prices more transparently and allow for patients to really get a lot of value out of the healthcare that we provide. Also, the patients have more access to us, so they can make appointments really easily.
Has FPC fostered your professional and personal development?
What I love about First Primary Care is that we all work together as a team, and I think that we're seen as individuals. So if you have an individual interest or an individual strength, people see that and they encourage you to lean into those particular strengths. I asked if the office had any sort of wellness, champions or well-being initiatives, and they're like, no, but we would be interested if you would like to do that. So currently we have a Slack channel where we post weekly announcements about wellness wins and things that we can do in order to promote wellness here in our office. And so that was just kind of an organic idea that was encouraged to be an actual initiative. Those are things that I'm interested outside of my clinical role that they've really been able to encourage me to pursue.
How does your team at FPC compare to previous roles?
Yeah, so what I like about my team here at Spring Branch is that we all share offices, so that allows for us to interact a lot more, talk to each other about maybe some complicated patient cases, or ask, kind of compare notes of like, hey, how do you deal with this specific situation? Or I'm filling out this particular paperwork. Have you ever done that before? And it's very collaborative versus in the traditional model. I think that because we are kept so busy, seeing, 20 plus patients a day, you really only have time to see the patients that are in front of you, and you don't have time to really interact with people who are in your office. So you don't really get to know them very well on a personal level. So that's what I really love about our team environment. It's very collegiate, it's very supportive, and I get to interact with some of the people who are not clinical as well, which has allowed for me to learn about their roles and what they do for First Primary Care, which is really cool.
How has FPC influenced your patient care approach?
I would say that FPC has encouraged me to be a lot more hands-on with patients in terms of, giving me the time to follow up on, how they're feeling after I give them treatment, or follow up on how a specialist visit or a procedure went if it happened outside of First Primary Care, which I think it, goes back to like the time that we're allowed more time to figure out the solutions, like a long-term solution to it, versus just being like, oh, that's a problem, and then you have to kind of quickly move on to the next task without really being able to think things through.
Can you share an impactful patient interaction?
A patient of mine who came in to see me for a lot of different health-related problems and had difficulty in the past really getting clear diagnoses of what's going on. And so we really were able to take time like digging deeper into that history and really understanding, okay, what is contributing to those things. And so, we've been working together really closely, and I would say that since I've started seeing her, I think that she has gained a lot of trust back in the healthcare system as a tool to kind of get to the root of some of her health-related problems. And she's feeling a lot better, and she's been a lot more open and vulnerable with her physician, where in the past she felt like she wasn't heard and that people were ignoring the complaints that she would bring into the office.